Good afternoon and welcome to the May 18th Community Update. My name is Stacy Wood and I am a Public Information Officer here in the Emergency Operations Center. This Community Update is also available in Spanish on the Buncombe County Health and Human Services Facebook page, and that can be found on Facebook at BCHHS. Today's updates will come from Dr. Jennifer Mullendore, the Interim Public Health Director and Medical Director for Buncombe County, and Fletch Tove, the Public Health Preparedness Director for Buncombe County. We'll get started with Dr. Mullendore.
Good afternoon. As of noon today, there have been 176 lab-confirmed cases of COVID-19 in Buncombe County residents. We know this is a higher number of cases than is showing on our county website currently. And results from the state's dashboard being automatically updated by an electronic reporting system, while our dashboard relies on manual entry to enable inclusion of demographic information about cases. Our dashboard will be updated later today. Currently, there are 4 outbreaks of COVID-19 in long-term care facilities in Buncombe County. And sadly, we have had the first death associated with one of these outbreaks. Buncombe County Public Health has been working with a range of partners to support these long-term care facilities in their testing of staff and residents. I want to give a shout out to Range Urgent Care, Buncombe County Emergency Services, Blue Ridge Health, and LabCorp, who have answered the call and stepped up to assist with testing at these facilities. Since early last week, Buncombe County Public Health has been going above and beyond on our recommendations to long-term care facilities when they identify one case in a resident or staff member. While state guidance recommends testing of all residents and staff if possible, we are working with facilities and community partners to ensure that all residents and staff in these facilities are tested. And we are instructing those facilities to repeat testing within the following week and each week thereafter until no new cases are identified. This is a tremendous undertaking and requires a significant amount of resources: staff, personal protective equipment, testing supplies, and time. But these facilities and our community partners have worked with us to get the testing done. The lack of a coordinated plan at the federal level has hampered state and local ability to appropriately address this pandemic, and we are having to come up with solutions on the local level. As of this morning, around 1,000 tests were conducted in these long-term care facilities that are experiencing outbreaks. And by today's end, 2 of those facilities will have completed their second round of testing. We are working with Buncombe County Emergency Management and Asheville Fire Department to assist long-term care facilities with testing, guidance, and to provide personal protective equipment if a need has been identified. The North Carolina Department of Health and Human Services on Friday issued updated guidance on who should be tested for COVID-19. The new guidance recommends that all providers test any patient in whom COVID-19 is suspected. And remember, the symptoms for COVID-19 expanded a couple weeks ago to include people who have cough, shortness of breath or difficulty breathing, fever, sore throat, muscle aches, chills, shaking with chills, and a new loss of taste or smell. So in addition to anyone with those symptoms, the new guidance recommends that providers ensure that people in the following groups have access to testing, regardless of whether they have symptoms or not. That includes close contacts of known positive cases of COVID-19, people who live in or have regular contact with high-risk settings, such as long-term care facilities, homeless shelters, correctional facilities, and migrant farm worker camps. People who are at high risk of severe illness, such as those over the age of 65, and people of any age with underlying health conditions. People who come from historically marginalized populations, healthcare workers or first responders, and frontline and essential workers in settings where social distancing is difficult to maintain. This greatly expands the number of people who are now to be considered for testing. But it also leaves several unanswered questions that we are working to answer on the state and local level, such as when should asymptomatic individuals in these high-risk groups have repeat testing? We have to remember that the diagnostic testing that is done for COVID-19 tells you that at the point in time when that individual was tested, they did not show evidence of infection. But it doesn't mean that 2 days later, that individual won't test positive if they were tested again, if they've had an exposure and been infected. So at this point, we are still waiting on guidance on how soon thereafter that first test should someone be retested. I've looked to guidance elsewhere when it doesn't exist at the state or federal level, and other well-respected public health agencies in the country are recommending a possible retest of every 2 weeks. Again, this is an enormous undertaking. And while testing capacity has definitely increased and continues to increase, there are a lot of logistics to work out to get this testing done. So we'll be in communication with local providers and clinics and with commercial labs to support testing of these recommended groups in the very near future. Last week, we had 2 community-based testing events in which approximately 100 individuals were tested in total. Western North Carolina Community Health Services will be contacting those individuals who were tested with their results. Our community-based testing events are scheduled to continue this week and in the coming weeks. Please remember, these are intended for walk-up testing for individuals who live in those communities. Inclement weather will be a factor this week, as the forecast calls for rain pretty much the entire week. We will notify the community of any postponements by 9 a.m. on the morning of the scheduled event. And details of the testing sites are available at buncombeready.org. As it stands, the plan is to be in the Pisgah View community tomorrow, Tuesday, from 1 to 4 p.m. In Sandy Mush Community Center on Wednesday from 1 to 4 p.m. and at Deaverview Community on Thursday from 1 to 4 p.m. I encourage individuals who have symptoms of COVID-19 or fall into one of the populations encouraged to be tested by the state to reach out to your healthcare provider first and foremost to see if they can conduct testing. If not, then I encourage you to call one of the clinics in town who is offering telehealth and testing. These include Mayheck Family Health Center at Biltmore, all 4 Mercy Urgent Care sites in Buncombe County, Range Urgent Care, and now Mission My Care now at Biltmore Park. I encourage you to look at our website for information about how to contact these clinics. And please call them before you arrive, as they have certain hours for testing and want to do telehealth screening in advance. For those with insurance, testing should be covered by your insurance provider. For those without insurance, many clinics have signed up for reimbursement of COVID-related visits and testing through the federal reimbursement program. But please check with your provider about any cost before you show up. For our community testing sites, language access services will be available during the hours of operation. And we encourage anybody who has health insurance to bring your insurance information to those sites. I want to thank everybody who is taking COVID-19 seriously. I want to be clear, this is not a joke, and it's not somebody else's problem. It is everybody's problem, and it's everybody's responsibility to do the right thing. I live here, and as I was picking up dinner for my family this weekend, I observed many people who were not taking the steps necessary to help slow the spread of COVID-19. That was not what I wanted to see. And I know that's not what our communicable disease nurses who are working very hard to investigate all these cases wanted to see. So families and people who are out and about, people who are working every day, please take steps to be careful and cautious and to take care of our community. As COVID-19 spreads and our numbers continue to grow, we will go back to work and fill the streets and parks and office buildings and shop in stores. But as you do this, remember COVID-19 is here, and you must act as if it is around you, and as if you yourself may have it. Please take steps to keep from spreading it. Wear a cloth face covering. Wash your hands. And keep your physical distance from others outside of your immediate household as much as possible. Please take care of yourself and everyone around you. We are all depending on you. You are depending on me. Our actions matter and will make the difference in how we come through this pandemic. Thank you.
Good afternoon. Fletch Tove, Public Health Emergency Preparedness Director. Governor Cooper's Executive Order number 138, his Phase 1 order, remains in effect through this Friday, May 22nd at 5 p.m. We expect that later this week, the governor's office and his COVID-19 task force will start sharing details about the planned rollout of Phase 2. While we don't yet have specifics, we have a general framework from the state about what we can expect. This framework may include lifting the statewide stay-at-home order, encouraging vulnerable populations to stay home, allowing a limited opening of restaurants, bars, and other businesses that can follow physical distancing protocol and operate at a reduced capacity. Allow gatherings at houses of worship and entertainment venues at a reduced capacity. Increase the number of people allowed at mass gatherings. Open public playgrounds, all while continuing rigorous restrictions on nursing homes and other congregate living settings. As soon as we have details about what Phase 2 entails, Public Health will make recommendations to county leadership outlining our path forward. I'd now like to take a moment to talk about face coverings. Wearing a face covering in a public setting is one of the best tools we currently have for minimizing the spread of COVID-19. If only people who had symptoms infected others, only those people who were feeling sick would need to wear a face covering. But we know for a fact that people who never show any symptoms associated with COVID-19 are infecting others. In fact, studies consistently show that roughly 50% of new cases are infected by people who themselves are not showing symptoms. This means that healthy people are infecting others, probably without ever knowing they're even sick themselves. That's why it's so important for everyone to wear a face covering. These non-fitted masks, whether they're bandanas, head wraps, hand-stitched masks, are intended to protect others. They work as a barrier to physically knock down droplets of saliva, and they are very effective. Many studies show that if just 80% of the population wore a face covering when in public, the transmission of COVID-19 could be severely slowed and even halted. So without a treatment and without a vaccine, the combination of face coverings and physical distancing are the best tools we have to fight this pandemic. So the face covering is an effective tool in our fight against COVID-19. But wearing a face covering in public is much more than that. It's a symbol of caring and compassion. It's a symbol of community solidarity in challenging times, and it's recognition that the consequences of your actions extend past your own household and may affect the lives and families of others. So protect others when you go out and wear a face covering. As always, let's stay safe, let's stay smart, and let's take this step by step. Thank you.
So for more information on testing and signage and guidance for local businesses, you can visit buncombeready.org, where we have posted an array of information and signage and resources that people can use in their places of business that outlines and underscores the importance of these public health measures. We also want to let the community know that there will be a planned internet outage for the Buncombe County website on Wednesday, May 20th, from 3:30 to 5:30 a.m., as our IT department will be making a major upgrade to the county's website during this time. The next community update will be provided on Thursday. Thank you for staying engaged.